perform a joint centration technique for the humerus. Now, what is joint centration? Well, when we move our arm through a range of motion, we want our joint or our humerus to stay on its axis. The humerus is 4 times the size of the glenoid fossa. That humeral head is 4 times the size of the glenoid fossa. So you have to make sure through motion that it doesn't glide in the anterior direction. Now, if it glides in the anterior direction, especially when you're going from maximal external rotation into internal rotation, which is your throwing mechanics. Remember when we're at our late cocking phase and we're moving into acceleration, you want to be aware of this humeral anterior translation because it can put some stress on the structures in the anterior aspect of the humerus, the capsule, the biceps tendon, and the other structures in that region. So you're going to set the patient up in a supine position. You can either take them from maximal external rotation into internal rotation, or you can start them in a neutral position. Either is fine. They're going to rotate their humerus into internal rotation, and you're going to look to see if the humerus glides anterior, potentially placing stress on those structures, or if it stays stable in its resting position. You're also looking for any pain that this may be generating. So the patient's going to be in the supine position. You're going to place their arm on a towel, or their humerus on a towel. They're going to go through this internal rotation motion. Now, why do we use a towel? If we didn't use a towel, the humerus would be more in lateral abduction, and that could put a lot of stress on the anterior capsule. Because think about it, that lateral abduction can cause the humerus to glide forward in that pre-position. So we want to make sure that the patient is pre-positioned into a position of comfort. Now we can start this test in full external rotation, just like so. Or we can start the test in the neutral position. I'm going to start in the neutral position just so you can more easily visualize the motion. I'm going to come down to this level. And first I'm going to take the patient through passive range of motion. Aaron, I'm just going to bring your arm inwards and back out. Now going through passive range of motion, I'm making sure he's not gliding. And I'm getting appreciation for his end range mobility. So he has approximately 45 degrees of motion. Now as I watch him go through this humeral internal rotation, I want to make sure he can reach that 45 degrees of motion without that glide forward of the humerus. So I want you to position your eyes right into this region and look to see if his anterior aspect of his humerus stays stable or if it glides into the anterior direction. So Aaron, I'm going to have you go into that same rotation. And this first example is going to be nice and stable. And then come back. So we did an excellent job. You notice no anterior glide or anterior motion of that humerus, and there was no pain with the motion or the position. So this would be a centrated joint.